Guys, hello everybody, my dear students, my beloveds. Take your pens, papers, and let's go. Today's topic is peptic ulcer. Well, we used to talk several times about that, actually the same history as the gastritis. Anyway, so my beloved students, take your pens, papers, and let's figure out that your exam tickets, you take your exam tickets and there is a peptic ulcer on your exam tickets. How to answer exam questions. Absolutely necessary to make the notes, my beloveds, because it's absolutely necessary. It's of crucial importance. So you start always with definition, okay? So peptic ulcer is an erosion in a segment of the gastrointestinal mucosa, typically in the stomach. That's why sometimes we use term gastric ulcer, or the first few centimeters of duodenum. That's why it's a duodenal ulcer that penetrates through the muscularis mucosa. Nearly all ulcers are caused by Helicobacter infection, so-called, or provoked by non-steroidal anti-inflammatory drugs. Symptoms typically include burning epigastric pain that is often relieved by food. Diagnosis is by endoscopy and testing for infections. Treatment involves acid suppression and avoidance of NSAIDs. So this is a definition. The term peptic ulcer, why it's peptic, derives the name from the word pepsin, so PepsiCo, an enzyme produced in the stomach that plays a crucial role in the digestive process. Pepsin, along with stomach acid, helps break down proteins in food. Actually, it's the beginning of protein breakdown, digestion of proteins. However, when the protective mechanisms of the stomach or duodenal mucosa are compromised, pepsin, sometimes pronounced pepsine, or pepsin is the most correct, of course, and stomach acid can damage the tissue of these organs, leading to ulcer formation. So the term peptic indicates a connection to digestive process, specifically the action of pepsin and stomach acid. Therefore, ulcers that arise from the damaging effects of these factors on the mucous membrane are called peptic ulcers. So peptic ulcers are open sores that develop on the inner lining of the stomach, gastric ulcers, or upper part of the small intestine. That's why it's duodenal ulcers. So about Helicobacter pylori, you know my opinion about this tail. It's a completely tail, but anyway, so on the infection, on the big exams, we have to talk about Helicobacter pylori. This bacteria damages the mucous coating that protects the stomach and the duodenum, leading to ulcer formation. NSAIDs the number one provocator. It's NSAIDs. Long-term use of NSAIDs such as ibuprofen and aspirin, even not long-term, can reduce the stomach's ability to produce protective mucose. Other factors: smoking, excessive, not good quality alcohol consumption, psycho-emotional stress, and sometimes maybe spicy foods can aggravate symptoms and contribute to ulcer formation. But the first and crucial is smoking and stress, psycho-emotional stress. So about pathophysiology, imbalance between aggressive and defensive factors. Ulcers develop when the aggressive factors, for example, stomach and pepsin, the stomach acid, overpower the defensive mechanisms, that is, mucus bicarbonate, blood flow, mucus bicarbonate, blood flow. Infection. This bacteria, that is Helicobacter, releases enzymes and toxins that disrupt the mucous barrier, leading to inflammation and increased gastric and secretion. But the problem is not Helicobacter. So NSAID use, these drugs inhibit the production of prostaglandins, which normally help to protect the gastric lining by stimulating mucus and bicarbonate production and maintaining the blood flow. So concerning classification, so we understand from the beginning that we can classify gastric ulcers occurs on the inside of the stomach, and duodenal ulcers. These ulcers occur on the inside, on the upper portion of the small intestine, that duodenum. Symptoms, the common symptoms, of course, it's a pain, burning stomach pain, feeling or fullness, bloating or belching, fatty food intolerance, heartburn, nausea. Actually, it's not a fatty food, it's carbohydrates. And some fatty foods, yes, especially fast food intolerance, because it's not a good oil that used in the fast food industry. Severe symptoms: vomiting or vomiting blood, dark blood in stools or tarry stools, trouble breathing, feeling faint, unexplained weight loss sometime, and appetite changes. So diagnosis is of course medical history and physical examination, assessment of symptoms and risk factors, endoscopy, direct visualization of the stomach and duodenum to detect ulcers and collect biopsy samples, Helicobacter pylori, blood stool or breath test to detect the presence of Helicobacter pylori, completely tail, barium swallow, X-ray examination of the upper digestive system, and finally management. So treatment, medications, of course, now it's we have to understand it's a protect against stress. Antibiotics, if we talk about Helicobacter pylori, proton pump inhibitors reduce stomach acid production, ACE2 receptor antagonists decrease this acid production, antacids neutralize stomach acid, cytoprotective agents protect the stomach lining. Lifestyle modifications: avoid NSAIDs how much it's possible, limit alcohol consumption, completely quit smoking, and manage stress. Avoid foods that might irritate the stomach, such as spicy and fatty foods. I repeat, not good quality foods. In rare cases, surgery may be required for complications like a bleeding, perforation, or obstruction. So concerning prevention, they talk about Helicobacter pylori management, early detection and treatment of Helicobacter pylori infection. You said this, but don't use in your practice. So it's largely sufficient for your answer, my beloveds, on the big exams, state exams. God bless you. Don't forget to follow and subscribe our channel. See you in another lectures. God bless you. Bye-bye.